This is Aurora from Refresh Valley Dental, and I wanted to talk to you a little bit about different kinds of dentures and what your options are. So there's the traditional kind of denture that most people probably think about when they think about dentures, and that is the kind that just goes right over the gums, and usually it's pretty tricky to eat with, especially in the beginning. Most people who've had them long enough will eventually get used to them, but there's just certain kinds of foods that you can't really eat anymore, or at least not in the same way. Typically, the amount of chewing power you have with those will be maybe 10% of what you would with your natural teeth. The next option is going to be what I usually call snap-in dentures, or the more official language would be implant over dentures. And these typically attach to 2 to 4 implants per arch. So that's either 2 to 4 implants on the bottom or 2 to 4 implants on top. And that allows your denture to have more of a secure base to really attach to, so that they don't move around nearly as much. And it gives you a little more power too. Typically maybe 50% or 60% of what you would have had with a full set of natural teeth is what you would get with the implant over dentures, aka the snap-on dentures. And with those, I usually do recommend, if you're gonna do just one, do the bottom, because the bottom is typically the denture that has more problems with moving around. Last but not least, we do have the dentures that just stay in all the time. With these, you're looking at least 4 implants. Usually most people prefer to put about 6 in per arch, so 6 in the bottom or 6 in the top, and then they stay in. They don't come out unless you're seeing the dentist and they're removing them professionally. These are the most powerful, the most like natural teeth, but they are still a little bit different. So there's going to be a bit of a space between the base of the denture and your gum. And some people notice that there's like a little bit of a whistling sound with that. It's not super noticeable for other people, but when it's in your own mouth, of course you're gonna hear anything that's even slightly different. Also, it doesn't feel the same as using your natural teeth to bite into something, because we have ligaments around our natural teeth that can sense that kind of thing. So it doesn't feel exactly like having your teeth back again, but it will get you 90 to 95% power of that chewing power back. So that's definitely nice. They are a little bit harder to keep clean than the other 2 types of dentures, since they don't come out of your mouth. You do have to be very careful about that, because the thing about implants is, although they can't get cavities, they can get gum disease. So that's the basic 3 kinds of dentures. If you have any more questions, please give the office a call. Our number is 413-387-4585. All right, take care.